been asked today just to provide a perspective from ADAS on iblon, which we've been working with now since 2018. And over that period, we've conducted about 20 trials looking at Septoria, yellow rust, brown rust, powdery mildew, all the diseases you'd expect us to be focusing on. The first two slides first two graphs show the efficacy that we saw on Septoria, which dominated in Herefordshire and Nottinghamshire as well. And this was the Merit and Dawson. And you can see on the left-hand side there, actually, and the right, the green line of Univoc actually comes out very well in these comparisons. Clearly, fenpicoxamine is a very active molecule on Septoria, and that was shown here. When we look at Revistar and iblon, actually they compared very similarly in terms of their efficacy on Septoria in these sites. And Ascra actually was perhaps just a shade behind, but not doing badly actually, still performing reasonably well. Where we looked at rust, though, the picture was quite different. On the left-hand side, you've got the activity that we saw from those T1 timings by the 25th of May, so roughly 3 or 4 weeks on. And actually, iblon plus prothioconazole came out very well there. Univoc, less good, in fact, than that. And Revistar actually looking weak by comparison to the other three. We took those 3 trials to yield, and in those trials we did have, as I said, several diseases, Septoria, yellow rust, mildew. And when we combined the yield from those, we would have said actually the Revistar and Ascra yields look very similar. And equally, the iblon plus Univoc were at a higher level. What did all that mean in terms of green leaf area? This was perhaps the clearest result that came out of the trial, where we had a mixture of diseases on this variety. This was in Cider and Huntington. We clearly saw iblon prothioconazole come out very well. And that looked significantly better in terms of green leaf area retention compared to Univoc, Revistar and Ascra. Iblon, isofluoxetine, clearly a valuable addition to fungicide programs. It is more active than existing SDHIs on Septoria. By saying that, I know we have seen changes in efficacy on Septoria from the SDHIs. The floxapyroxad, benzovindiflupyr actives we know have faded in time and are not as effective as they used to be. Bixafen also falls in that category. But this is showing a level of activity that appears to be above what we saw from those. So it's more inherently active. It probably will be subjected to the same continuation in decline over time. But that inherent activity hopefully will stand it in good stead in the short to medium term. That's great from an efficacy point of view. That means we've got 3 different modes of action out there. And those 3 modes of action, QIIs, fenpicoxamine and mefentrifluconazole from the azole category, means that from a resistance management point of view, we've now got quite a strong position where each of those different modes of action should provide mutual control for the other, which means that we should be in a good place to manage our diseases for the medium to long term. Iblon has also been shown to be very active on a broad, especially when in combination with prothioconazole, on a broad spectrum of wheat diseases, primarily the rusts, though. It seems particularly effective on yellow and brown rust as well. And I think because of that, it's pretty well suited to T1 or T2 application timings, and exactly where you use it might depend on what disease profile you have and what varieties you're growing.